So welcome back to those who have returned to us, and welcome to those of you who are with us for the first time. My name is Sandra Smith, and I'm the faculty chair of the program in criminal justice. I am also the co-organizer of this speaker series, along with my colleague, Christopher Winship from sociology and beyond. Chris can't really be narrowed down to just sociology. So we have put together this semester what I think is an exciting lineup of speakers, and they'll be engaging us on the central theme for this academic year, which is reimagining public safety, offering different perspectives and insights than those we benefited from this past fall. So our list includes Rasan Hall from the ACLU's Racial Justice Program, representatives from Boston's own ROCA Incorporated, Cure Violence Global, the Anti-Police Terror Project from the Bay Area, Black Visions Collective from Minneapolis, Cahoots from Eugene, Oregon, and Puente Human Rights Movement out of Phoenix, Arizona. Also in the lineup, or on the lineup, or whatever the preposition is that I'm supposed to be using here, is State Senator Will Brownsberger, who is here to discuss recent Massachusetts state police reforms. The progressive probation chief, Wendy Still from the Bay Area, San Francisco and Alameda County. And then a panel of mayors, including Joseph Curtatone from neighboring Somerville and Kathy Sheehan from Albany, New York, who will talk to us about the efforts that they have been making to achieve or reimagine public safety and barriers and difficulties they've had on that front, and some of the successes that they've had in the process too. So, but leading off the speaker series this semester is Keyla Jackson, who launched the Jamaica Plain Hub, a strategic partnership with the Boston Police Department and community partners to provide residents in need with much needed resources and services. These efforts put forward, at least in part, to help prevent violence and crime within the communities in which they live. Keyla has worked in community services department at MassHousing for at least 6 years now, focusing primarily on public safety and community engagement issues. Keyla is joined today by Isaac Yablo. He is a PhD candidate at the University of Massachusetts Boston and is a skilled mixed methods researcher who has partnered with Keyla to collect and analyze data on the Hub's efforts. Together, they will share with us the Jamaica Plain Hub's efforts, hurdles, and successes toward building a safer Jamaica Plain and beyond. Now, as most of you know, our speakers, our guests can go either way. They can have a conversation with me or my colleague, Chris, or they can give a presentation and then we open it up for Q&A afterwards. So Keyla and Isaac have decided that they would like to present to us, and then Chris and I might offer a few questions before we open it up to the broader audience. Keep in mind that we would love for you to keep your questions brief, just so that we have enough time for everyone who wants to ask a question to be able to ask a question. And don't hesitate to leave your questions in the chat along the way. As soon as we open it up, we'll start from the top and move on down. So with that, I would love to welcome Keyla and Isaac to the Program in Criminal Justice Speaker Series. Thank you so much for agreeing. We're excited to hear what you have to share.
Thank you for having us. So I'm going to allow my co-presenter to start. Isaac?
Hello, everyone. It's great to be here. It's great to have the opportunity to have such good discourse surrounding such a polarizing topic that is community safety. So I am Isaac. I am a PhD student at UMass Boston. I'm also a son of Cambridge, Massachusetts. I was born and raised there. I went to high school there. And my research interests at UMass really center around gangs and gun violence, police community interactions, concentrated urban disadvantage, but really more specifically in terms of policing, I look at collaborative frameworks that are either police-led or police-involved. That's really how I got involved with the Hub. I was working with the Hub with Keyla for 2 solid years, and we were able to gather a lot of really rich and amazing data on the program, and I'm really glad to be presenting it here today.
Awesome. So I will start sharing my screen and we will get started. So my name is Keyla Jackson, and I am a community services analyst at MassHousing. My work centers around community engagement and public safety. MassHousing is an independent quasi-state agency that was founded in 1966, and its charge was providing and financing affordable housing across the state of Massachusetts. MassHousing's mission is to confront the Commonwealth's housing challenges and to improve the lives of its people.
Now the hub program, I'll let Keyla get into a little bit how we got here, but just a quick background on what the framework is. So it's a multifaceted team of government, community, and law enforcement agencies and stakeholders that meet on a periodic basis. Sometimes it's a week, sometimes it's bi-weekly, to address specific situations regarding residents and families facing acutely elevated levels of risk. And really the goal of the meeting is to develop an immediate and coordinated response through the mobilization of the resources that are at the table. The hub is not a table where there's a lot of case management going on. In fact, there's no case management. The point of the hub is to have everyone on the same page as far as knowledge of a particular acutely elevated situation, and then to have everyone who can offer a particular resource offer that resource. Case management is left up to the particular agent connected to resources. The framework was born in Canada, in the Saskatchewan, Saskatoon area. I'm not too familiar with the provinces up there, but it eventually spread across the entire country, across all 13 provinces and territories. The framework is really widely used up there from across a number of different law enforcement and policing entities. And through the work and amazing work, I should say, of Keyla, the framework was brought to Boston after she observed the program successfully launch in Chelsea, Massachusetts. So the entire name, so we just call it the hub because we don't have a core yet, but the entire name of the framework is actually, it's formally called the Hub and Core. The core stands for the Center of Responsibility, and the core is not structured the same way as the hub. The core is really more focused on the broader notion of community safety and wellness. It takes a lot of the information that is gathered at the specific hubs, whether it's the trends and data or the different patterns of what these specific agencies at the table are seeing, and it brings everyone together to have a conversation on that kind of more macro, above, off the ground level, if you will. The main function of the hub is really to identify best practices in data collection and analysis, and then really situate each hub table to be a rich place of data collection and a place where there can be a lot of productive research that comes out of them. And as I said, we don't currently have a core, but the core is a vital part of the entire framework. As it stands right now, the hub is fairly new. I believe in Chelsea, I want to say maybe 2015 or something, it came to Chelsea. And so after Chelsea, Boston was next, and then, or not next, but it was soon after, and then it kind of spread across the state. So in Suffolk County, there's currently 3 hub situation tables, the Jamaica Plain, East Boston, and Chelsea hubs. In Plymouth County, we have some partners on the call right now. They do amazing work. So the Police Assisted Addiction and Recovery Initiative, they were able to take the framework and establish 4 situation tables across 23 communities in the Plymouth County area. There's a hub in Springfield There's a couple of hubs in Essex County, in Lawrence and Lynn. There's one in Middlesex. Cambridge is now kind of taking a framework that's similar to the hub and starting to implement something. And then there's a Worcester hub.
So how did we get to the Jamaica Plain Hub? In 2016, MassHousing's Community Services Department was undergoing a strategic change, and we were looking for really impactful and proactive ways to support our residents, to support neighbors, and really to support the community. After several visits to Chelsea, I was able to learn more about their hub. I presented the framework to community partners and to Boston Police for buy-in. And in 2018, June of 2018, the hub was launched by MassHousing in collaboration with the Boston Police Department. When the Jamaica Plain Hub launched, there was a hub that was launched in East Boston by the East Boston Health Center, as well as their trauma team. So MassHousing decided to invest in the hub model because it's an innovative and proactive way to support and stabilize families and communities in crisis. The hub delivers a range of solutions that are not limited to reactive enforcement alone. What we find is that police may have a house that they go to for repeated calls, and they're arresting someone, and they're constantly arresting someone, and they haven't gotten to the root of what the issue is. And what the hub does is bring those kind of situations to the table so that we can figure out what the issue is and try and address the issue. So the police are not going back and forth to that house for constant calls. Hub weekly partners include social service agencies, schools, domestic violence shelters, recovery coaches, housing specialists, community health centers, the courts, including probation. We'll talk a little bit more about the courts and the relationship that the Jamaica Plain Hub has with the West Roxbury District Court, local hospitals, the neighborhood trauma teams, child welfare agencies, and city constituent services.
And really, Kayla, I want to piggyback on something that you did, the comment that you made, where the officers are kind of responding to what we would call frequent flyers out there. A lot of the time, it's not their job to figure out why certain things are happening. They're there to do a specific, duty, and you have the officers a lot sometimes that are willing to figure out the root cause of it, but a lot of the time they're not. So this situation table really allows these officers kind of to throw everything at the social service providers that are available and say, we are not equipped to deal with these issues. We need your help. And so this is the actual, this is the visual of how of how each discussion works. So if a particular agency has an individual or family that they feel that they need assistance with, they will formally introduce them to the table, right? So it starts with the individual screening, where that referring entity kind of gives the risk factors related to that particular situation. And the risk factors are on the right here. So everything from substance use to criminal involvement, truancy, gang-related stuff. It could also be stuff related to mental, physical health, cognitive impairment, basic needs, or so have you. So once those particular risk factors are delivered to the team, as a team, we determine whether the individual is, one, at acutely elevated risk, crossing multiple thresholds where there is a consensus of a probability of harm, and that these particular entities that are referring these individuals, it's kind of like a mutual agreement that they cannot themselves address this situation alone, and that they need additional help. So if we all agree on that, we move to the third filter, which would be where we actually, this is the first time in the conversation where you'd present any identifiable information. So going back to the second filter, where we're discussing whether this individual is at acutely elevated risk. If we as a team decide that this person does not meet our threshold of risk, which we like to say is at least three to four risk factors related to the situation. If they don't meet that threshold of risk, oftentimes we'll say to that referring entity, go back to the drawing board. We don't need to discuss them at this particular table, right? That doesn't mean that we can't assist you, but that just means that we do not need to share identifiable information related to this individual at this table, because one of the main things that the hub prioritizes is confidentiality. While we are discussing individuals using their names one time, confidentiality is still a priority. So if we decide that this individual is not at acutely elevated risk, we'll turn them back. If they do meet our threshold for risk, which is 3 to 4 risk factors, that's when we'll present identifiable, very limited, but identifiable information on this individual. So name, date of birth, and address. That's it. We say it one time. That is for recognition purposes. So if any of the participating entities in the room have had contact with this individual or family, that's when they'll be able to say, yes, we know who you're talking about. We'll take charge of this situation. If we don't have a particular entity that is aware of this family, then we move to the kind of what I would call the filter 3.5, where we decide who needs to be involved in this actual intervention, which would be the filter 4. Who needs to be involved here? Who can offer a resource, or who has information on this family or individual that is necessary to know when you're trying to provide services, right? So that's the third filter, third and 3.5. The fourth filter is really where the work actually gets done. This is a confidential conversation only with the entities that can offer some assistance to this situation, right? So there's an offline discussion that happens where there's a plan to mobilize the resources that are available. And then there's a literal these door knocks are sometimes at doors, sometimes they are, approaching someone in the street. So it's the direct intervention and mobilization of the resources that have agreed to help.
And I must also mention, Isaac, that only those agencies that can provide some sort of resource will be involved in the filter 4.
It's not a time to just listen about what's, about this person's personal life. It's not a time for that. It's literally just a plan to strategize and mobilize with individuals that have something to offer.
So what are the possible outcomes when a situation is introduced to the hub table and the filter 4 is completed? The following week, the situation is reviewed at the hub table for updates. So these are some of the possible outcomes of any situation. We may be able to connect that individual or family successfully to some sort of resource that will mitigate the risk and prevent further harm. That family or individual may refuse services, or we may not be able to locate the individual. And specifically, if we have an individual that may be homeless, we may not be able to locate them, and we may then opt to close that case once we're unable to locate them. Agencies that attend the Jamaica Plain Hub meeting regularly include the Boston Public Schools, the Pine Street Inn, Boston Police Department, Youth Connect, Brigham and Women's Hospital, the Elizabeth Stone House, Arbor, and West Roxbury District Court. This is just a sampling of some of our partners.
I'm sure all of you are completely blown away by the framework at this point. But if you do have the question of why the hub model, this is the reasoning why. It provides for direct intervention on identified and verified risk factors. Everyone around the table agrees that these risk factors are something that are worthy of mobilizing on if they are compounded with each other. So an example would be, like a young person that is truant, involved with substances, has some mental health related issues, and is criminally or gang involved, right? That would be like a perfect hub situation that everyone would mutually agree that this is a situation of acutely elevated risk. It draws on the resources and insight of multiple agencies. Again, the situations that we're discussing at the table are multifaceted and cannot just be solved by one entity, especially cannot just be solved by the Boston Police Department. There's an immense need for a plethora of resources from all different kinds of different service catchment areas, I would say. The hub is preventative, proactive, and it delivers a range of solutions not limited to enforcement. Again, I think the police as a whole, there's kind of like this notion that, we are not social workers. We cannot deal with things all alone, right? And oftentimes they don't really have many tools other than to arrest. And so this provides law enforcement agencies with the tools to actually adequately address, I should say, some of these situations of acutely elevated risk without relying on enforcement. And then perhaps most importantly, it's an evidence-based concept design and in execution. There's been none written in America just yet, but there's been numerous articles, academic articles, and evaluations done on this framework above us in our neighbor of Canada.
So the hub for us, it builds community trust. This is why we do it. It increased collaborations. We're not working in silos anymore. Everyone is at the hub table weekly. There are agencies that do particular work and we may not know what they're doing. When everyone is at the table, we can share our resources. It improves interagency relationships. It allows partners to have a better understanding of each other's work. What we've found at our hub table is that there are some cases that never make it to the hub table because partners will then call each other to get whatever that resource they may need for a particular family. It increases the overall sense of security and safety in that catchment area. And it increases the ability to identify and track social risks that's impacting a certain area. And that, you kind of allude to the work that the Corps would do based on that part of the hub.
But also with that is, in a perfect world, the hub works where the officers are referring individuals that are popping up on their radar as it happens in real time. So with that, you can get a kind of, depending on, the extent that the officer is covering the entire neighborhood, you can get a pretty good hand on the ground level risks that are impacting people within the neighborhood by looking at the risk factors that are popping up at the hub, right? So it's obviously not going to tell you the complete story, but you do get a very good idea of certain things that are impacting the neighborhood broadly. So hub by the there's been 100 plus situations, 130 plus rather situations that have been introduced since 2018, most of which 85% have been introduced by the Boston Police Department. 74% of these situations involve 40 to 59-year-old men, many of which, 94% of which, have risk factors related to housing, homelessness, substance use, and mental health, right? Leading to almost 100% of the filter for situations, filter for discussions involving the best team, Boston Police Department, and MassHousing. Right now, we're at a very, very positive rate of 79% individuals connected to resources. This may not necessarily be on the first go around, but eventually they have been connected. So we've had individuals that have been referred to the situation table more than one time, whether it's because new risk popped up or because they denied services the first time. But all together, we're at 79% of individuals have been successfully connected.
So Judge Kathleen Coffey, who oversees the Drug and Mental Health Court at West Roxbury District Court, has worked closely with the Hub since its inception. We work with Judge Coffey when we have individuals who are experiencing some mental health issues or may have some addiction issues. We will go into the court to seek a section, and I'm going to let Isaac talk a little bit about our sections with Judge Coffey.
So according to the Massachusetts General Law, Section 12, Chapter 123, there are two sections that allow individuals to be placed into custody if they present a risk to themselves or others. One of them is the Section 12, which is a mental health or psychiatric related placement. These placements last, I believe, up to 72 hours, 3 business days. And again, they are most often used, I would say, by the police department when they're dealing with an individual that's presenting a danger to themselves or others, a psychiatric related danger to themselves or others. And then there's the Section 35, which is similar to the 12, where it's an involuntary hold, but the 35 is a substance use related hold, and that can be up to, I'm not sure, maybe 90 days.
21 days.
Is that the Section 35?
21 days for us.
21 days. So, I mean, they're both involuntary holds. One of them is mental health related and the other is substance use related. So if we're dealing with the Hub situation that, does meet the threshold for a section, we will often move to get them sectioned with the assistance of Judge Kathleen Coffey.
And normally when we move to have them sectioned, it's because that we've seen repeated police reports, or that individuals have appeared in a number of police reports for similar kinds of incidents. And we will then request that the police do a section and take it into court to Judge Coffey, who often will sign off on the sections for us.
Now, is in the room. So the Boston Police Department recently formed, I don't want to say recently, they're a couple of years old now, but they formed what is known as the Street Outreach Unit. These officers are tasked specifically with dealing with the issues surrounding housing, homelessness, and substance use that they see on the streets of Boston. It's a very small unit, 7 or 8 officers, but they do a lot of high impact work. Also at our table, we have the Pine Street Inn, which is a large homeless shelter network in the city of Boston. And this kind of we figured it out as a best practices as we kind of went on, but they've really been able to form their own partnership across service lines, because what we found is that a lot of the individuals that we would section, or a lot of the individuals that we were dealing with that had mental health or substance use related issues would be sectioned, but then they would kind of fall off the grid and then somehow end up back on the street. And there was really no communication across the police and the homeless, the entities that address homelessness in the city. So what the Hub has been able to do is really help to form a more of a connection between the street outreach team and then outreach workers that work for Pine Street Inn. So when an officer will section someone and then they go into treatment, Pine Street Inn, they have a specific team that works in collaboration with the Department of Mental Health, where they're able to go in to wherever this facility is that the individual is being held at and work with them, quote unquote, behind the wall until they come out. So that way they don't fall off the grid to us. We're getting consistent updates on them as they're getting services, so that we know the best way to address them when they're going to be released. So sometimes that's work to help that individual secure permanent housing. Other times it's, work to get them connected back to the recovery coach. that we have on the team. So it's really become a glorious partnership between the Boston Police Department and the Pine Street Inn.
Some of our success stories, and we'll talk a little bit about those. Situation number 44, we had a female who was 60 to 75 years old. Her risk factors included she was homeless, suffering from some mental health issues, poverty, and alcohol and substance use. We found that she had been living in her car, which was parked in the parking lot of a local variety store. She became a hub situation for us. We were able to get her out of the car. We were able to get her into treatment. We were able to get her transferred into some temporary housing. The Pine Street Inn and some other agencies worked with her, and she subsequently moved into permanent housing. Our second situation was situation number 46, female 30 to 39. She's a mom of 3 kids, a 17-year-old, a 16-year-old, and an 11-year-old. Her risk factors included food insecurity. She was undocumented, severe trauma, basic needs, and housing. She had been residing in a one room of a rooming house with her 3 boys. So after fleeing El Salvador and being separated at the US border for several months from the kids, mom made her way to Boston. They were reunited and they came to Boston. She became a situation for us where initially it was around providing food for her. Since then, we've been able to work with her to ensure that she gets food regularly. She's getting support now, and she is moving into permanent housing and out of the situation where she's living now.
And we've supported her as recently as, what was that, Kayla, 3 weeks ago or something like that?
3 weeks ago, we were able to provide some supports for her. We have another agency that's working with her now around helping with some of her moving expenses.
In situation 91 is a male 40 to 50 years old, risk factors, experiencing homelessness, experiencing substance use related issues, poor physical health, and mental health. He had a pretty severe injury that was hindering him from a number of different things. Very complicated social service industry in Boston. He was referred to the hub, and we were able to get him connected with one of the street outreach officers who was able to build a pretty good relationship with him after there was kind of a soft handoff from the man is a Haitian man, and we had one of the Haitian officers from Jamaica Plain kind of do a soft handoff to the street outreach officer. And that officer was able to work with him. I believe he was sectioned at one point, but then got clean and then was able to secure some permanent housing. And he's kind of been, for lack of better words, like one of the model hub situations for, and a model for the good work that the hub can do. There's also a situation 42. This individual, his risk factors were, just about as extensive as they come. Severe mental health related issues, substance use related issues, homelessness, criminal involvement, what have you. I believe he's, again, in that 40 to 59-year-old catchment area. And he was referred to the hub very early on, situation 42. We did a lot of intense work with him. At one point, I remember we approached him in a section of Boston. We were able to get him put in an ambulance and then sent to the hospital. And just through the continued work of the hub, specifically the Boston Police Street Outreach Unit, they were able to meet a 6-month milestone where Bobby's been clean for 6 months. So that was really good. That was really good work. And again, that was both a product of the hub and a product of the sectioning process that Judge Kathleen Coffey has partnered with us to create. So
These are just a few photos of the Jamaica Plain Hub in action pre-COVID, when we're able to get out and do some of those door knocks and go and meet some of our situations where they were. So what's next for the Hub? Next for the Hub, we are in the process of hiring a full-time Hub coordinator to manage the Jamaica Plain and the East Boston Hubs. Work is also to assist the Hub coordinator with the build out and launch of 3 additional hubs in Roxbury in District B2, in B3 in Mattapan, and in District C11 in Dorchester. Additionally, we are planning to build out a statewide hub and work with hubs across the state around policy work and best practice work. That concludes our presentation.
Excellent. Thank you so much for that, Kayla and Isaac. This is an incredible program. And as evidence of it, we have already a number of questions in the chat. I'm just going to be very clear with you. Usually it takes us about 10 minutes into Q&A before we have this number of questions. And so I'm really excited that folks are raring to go here. I think that you have addressed Rebecca's question number 1. How do you manage issues of confidentiality to protect individual or family needs for privacy? But if you could just very quickly restate the approach that you take so as to protect individuals and families' privacy.
You want to take it or you want me to do it?
You want to go ahead and then
Yeah, it's that again. So confidentiality is a very big, that's always like the first question that everyone has is, well, what about confidentiality and HIPAA? So I believe it was in 2014 after the Ebola breakout, HIPAA passed a guideline that allows you to discuss, as service providers, mind you, right? So as service providers, you can discuss individuals that are at or that meet a certain threshold for harm if something bad will happen to them, right? So we like to say everyone that we discuss at the Hub, if we do not act on it, something negative will happen within 24 to 48 hours. So the Hub framework operates essentially on that. Broadly, we also give the analogy, like if there's a house on fire, would you ring the doorbell before you go in to see if there's anyone that needs to be saved, or would you just run in? And so that's kind of how we operate. But again, the only time that we actually do offer any identifiable information would be on the filter 3, and we only give name, date of birth, and address one single time.
Thank you very much for that, Isaac. I'm going to allow the other questioners to ask their questions themselves. Renee, you have a question.
Yes, I do. And my question is, at what point is the individuals or family notified of the Hub process? So once you've identified them, however, and I guess I want to figure out, how do you identify them? And once they're identified, how do you then notify them that they're going to be part of this process?
So that normally happens in the filter 1, because if the police are not the only folks that can bring a situation to the Hub table. Any of the agencies that are sitting at the table can present a Hub case. It may be that that particular agency cannot manage the situation by themselves because they need additional resources, and they need some other agencies that offer different resources to be able to address and mitigate whatever that need is for that family. So it may happen prior to even coming to the Hub table. If we have a situation, there's sometimes where situations are discussed and it may be a youth, and one of our Hub partners may say, prior to even discussing this situation, I need to get permission to be able to do that. So we may move it to the next week once they get permission to be able to discuss that case. But it always happened in filter one because the agency that's bringing the case would have spoken to that family in advance and said to that family, I can't help you by myself. I need additional folks to be able to help you.
Thank you very much.
Yeah.
Oftentimes there's rarely pushback too because of the heightened level of risk that we're dealing with. I mean, there are some situations where people are like, I don't want services, or how did you get my name? But oftentimes the families are actually very, thankful that we're reaching out.
Okay, because I know even for myself working with families and what have you, a lot of times family are hesitant. They're afraid of what the real outcome is going to be. No matter how much you try to prepare them,
Yep.
they're still kind of hesitant. So that was just really interesting. Thank you all.
And I think when it's coming, let's say the agency was you, Renee, and I think when it's coming from you and you're saying, and you're reassuring that family that, hey, I have a group of partners that I work with that might be able to help you. I think families are more susceptible and more open to taking the help. And that's what we're seeing with our hub cases and our hub table.
Okay, thank you. I'm going to reach out to you directly.
All right.
Okay, so Jamie, Hub Day is up now.
Yeah, obviously public services have limited resources, so we end up means we bring in a risk-based approach, and you have to, it sounds like in this case, hit 4 of the areas of need before you get help. But often the downside of that is that when families or individuals are in a position where we can help relatively easily and cost effectively, we can't do anything because they haven't hit the 4. And then things get progressively worse and worse and more entrenched, much more expensive for everyone, much more difficult to get out of. And then they eventually get help at that late stage. Have you noticed that? And have you any way around that?
You're spot on with that. I think that that's across kind of like social service agencies and social risks. Like, I see the same thing, in dealing with individuals that are gang and gun involved. People like to say, well, unless they've caught in the charge yet, they're not official, that kind of thing. But I think that the important thing with the hub is that, there's kind of two processes going on here. There's the hub situation table, and then there's just the general process that everyone is coming together, for good or for amount of partners that are coming together. So if we tell an entity, I don't think that this person meets the hub threshold, that doesn't mean that they can't turn to the 3 agencies that are sitting around the table with them and still have that conversation. It just means that we're not going to discuss their very, very, very confidential information as a team, right? You can still have the conversation. You can do whatever you want. You can still reach out to the same exact entities that you would at the table to get the help. But it's just for the actual purpose of the framework. If they don't meet this threshold, then they don't qualify for that mobilized, coordinated approach. It can still be a collaborative approach, but it may not be as coordinated.
Right. And the hub has helped to break down some of those silos where folks were just working in that small area by themselves. And going forward, they can reach out to another partner and say, hey, I have an individual that may need some resources. You might be able to help me. And they may not have to wait until we meet on a Tuesday. They may call that partner in advance and do what they need to do for that family and make the connection for that family.
Okay, so next up is Kathy. Welcome back.
Thank you. It's a pleasure to be here. I think I'm looking at this from like a macro perspective, and I'm wondering how good it is at really looking at figuring out and fixing the root causes. So, for example, if you have truancy, but truancy is maybe related to young people who can't read. Like I worked with a young person in DYS that had dropped out because he was at the 2nd grade reading level and still in 17. So how good is it at finding the root causes and then really addressing them? Because sometimes, yeah.
I would say that it definitely can find the root causes, but again, the framework is not, it doesn't operate to do that. The framework is purely to connect individuals to resources that they may or may not have been aware of, right? So, you know, the kind of like the long-term mitigation of risk, that's left up to the particular entities that are involved in that kind of collaborative filter for conversation. Not to say that we don't have that information at hand at the hub, but that we don't collect it for the hub to determine whether the hub is successful or not, because the framework is really just to connect people to resources, not to sustain those resources, even just connect them to.
And remove that elevated risk.
Situational.
So for me, I feel like then there's a, you get all the data, which is wonderful. Is there a way, not necessarily you doing the work, but is there a way for you to put that data out there of root causes? So then you get, I mean, not just to put yourself out of business, but, you know, kind of in some ways to put yourself out of business.
Well, I think so long as that data is number one, de-identifiable, but
Yep.
two, I mean, not to be like pessimistic, but like, even if we put out the root causes, do I really think that they're going to be adequately addressed? Like, I don't know, because it's not like these root causes are like a secret to anyone, you know, like, you know, I mean, the situational risk and determining the reasoning behind the situational risk is definitely, you know, that's a challenge. But broadly, like we're seeing heightened levels of substance use specifically related to alcohol, right, in Jamaica Plain. And so the root cause of that is a bunch of different things if you're looking at the individual subjective level. But then kind of on the community level, you could say, well, it's that friggin' liquor store right there that's selling to everyone. That's
selling the nips, and then they have $1 and can go buy a $1 bottle of liquor versus being able to afford a $20 bottle of liquor, and they can, you know, find $1 somewhere versus $20 someplace to be able to. So yeah,
I think we're definitely honing in on, not necessarily, again, because it's so subjective, but we're honing in on kind of like more macro level root causes, but still it's very much a challenge, you know, and then trying to figure out the best way to address it, you know.
Yeah, thank you very much.
But also, you know, it's been told to me, like Ali from Pari made a very good point, like situations involving housing and homelessness, like we found that is often like very much a root cause in a lot of these situations, because again, you know, we can get someone sectioned, you know, 3-4 times, even put into detox, but then when they come back to the community and they don't have any resources at hand related to like literally just sleeping at night, it becomes that much more of a challenge.
Okay, Jackie is up next.
Yeah, so mine is more on the how does the officer in the department, is this an officer level decision of referral, or does the officers refer it to an internal department? And how do all the officers in the district know about this resource for referral?
So when the Jamaica Plain Hub was launched, we went to roll call and had a conversation with the officers who were on patrol. And we did roll call in the morning, we did the night, we did the evening roll call so that they would know about the hub. The community service sergeant is the officer that sits at the hub table. So when the officers who are on patrol, again, we talk about that repeat call where they're going to that house constantly, they will bring that police report up to the community service sergeant. He will then review the report and decide if it meets that threshold to become a hub case.
Also to Jackie, so we've had I would say at least within the BPD, we've had at least 6 different units at our table in addition to patrol and we've had patrol from multiple districts, right? So there's no set in stone. And I think, I don't want to say there's no defined within the description of the framework, there's no defined, level of law enforcement, like officer that should be at the table or should not be at the table. We've definitely identified patterns based on the officers that are at the table. So, I mean, like like the more well-versed and well-mannered sergeants and captains and deputy superintendents, those individuals versus the patrol officers that are still trying to kind of find their grounding within the force and are still trying to figure out like, oh, is it wrong of me to rely on like the hub? Am I not doing my job? That kind of thing. But like Kayla said, initially starting out, it was just a community services sergeant that was referring, and it seemed like he was in his own little silo coming to our hub table. Now, after we've gone to the roll calls and stuff like that, and he's made it more widely known, and now in E13, there's signs for the hub hanging in the department. It wasn't like that before. Now it's more widely known. We can make this referral. Same thing with Chelsea. I know in Chelsea, like we've been in a hub situation table meeting in Chelsea, and an officer has walked into the meeting, handed a referral to the captain, who then introduced it to the table, right? So I think it really depends on the situation. And then versus East Boston, they have one officer that does everything, and he is a community services officer. And so it really depends on the table. It depends on the size of the district or department that you're working with too, and their capabilities.
So it's on a kind of a captain level decision as to how the district is going to work the referrals.
Yeah.
I would say captain, if not higher.
Yeah.
Okay, Starsha.
Hi, thank you so much for sharing your work. This is really exciting to hear about. I am a research analyst at the University of Southern Maine, and I am part of a team who has a 4-year BJA, Bureau of Justice Assistance, community crime reduction grant. And so we're working across 4 rural counties in Maine to do something similar to what you've created. It's why we were really excited to hear about your work. Where we have a partnership with across 4 counties with 4 county sheriffs and the district attorney, and we're bringing together community members and service providers to really address the issue of frequent flyers, people who are cycling through the justice system, and connecting them to services. And I think you've already sort of answered my question, but I'm going to ask anyways, just in case, because you had said that you mainly focus on making those connections. And one of the things with our project is that we're looking at making connections. We're looking to measure things from police data, like the number of arrests for substance use related, drug related issues have gone down, the number of diversions or deflections into substance use programs. But we're also looking to measure some more qualitative outcomes for the participants who go through the intervention. And so I was wondering if, we're considering developing possibly a index variable to measure well-being, perhaps. And I just was wondering if you're doing anything like that to measure sort of some of the larger outcomes for the people who come through your hub process.
I would say yes and no. Definitely the qualitative aspect of things is kind of where I found a lot of the most rich data to be specifically related to this program, right? So just certain things that we've been able to identify, perceptions of success. That is one that is widely disputed because obviously law enforcement agencies are held to a certain standard, as are grant-funded community nonprofits, right? So, but specifically within this table, we found that, or at least preliminarily, we found that officers, when coming to understand if this idea of this hub is successful or not, they align more with the number of individuals that have been connected to resources. And they look at that. So like we've had 130, if 80, but then, then there's the discussion of like, is 50% the threshold for, like, what is, you know, so then there's that discussion versus the social service providers that are really more excited about that qualitative, like, oh, now we know more of the service providers in our catchment area that can help us. That's success. Oh, you know, like each week at the table, we know 2 more different, you know, representatives. That's also success. So like the dueling narratives of what success is that speaks to a much more broad, you know, phenomenon that's happening across the literature. I'll let Kayla go, but I would also say one more would be, you know, depending on the officer that's involved, their surface level engagement with the program. So like literally perfunctory, just going through the motions, like I'm going to make a referral. And, you know, I don't actually care to do anything with this referral, but I'm just going to make the referral to the table just to say that I participated, or I'm going to send this officer who's not going to do anything to say that we participated, you know, but, or to get grant funding even, but it doesn't really, you don't really do anything, right? So that's some of the things that I've seen.
Great, thank you. The other thing I'll just share with you is we're looking at also doing some social networking measurements to try and measure the level of connectivity between our partners. So thank you so much.
So Rebecca, you have a statement in the chat. I'm wondering if you have a question to replace the statement. If not, I'm happy to move on.
Well, I think it was about the section
in the 21 days versus they can be held for 90 days, but normally with our sections, we will see them back out after 21 days, and we're right back where we started with them versus spending the 90 days in which they can actually be held. So thank you for that, Rebecca.
Okay, Robert Bailey.
Hi, I'm calling from California. I'm a board member of the California Partnerships for Safe Communities. And it's a nonprofit that works with police around the state on gun prevention violence programs based on the ceasefire model that came out of Boston. And I was just struck by how much there's an overlap, or seems to be conceptually, between the hub approach and what the ceasefire approach does, which is to identify individuals who are highly at risk, partner with the community to marshal resources to offer them as an intervention. Is there any overlap whatsoever between your programs or the approach? Do you see them as mutually reinforcing? I'm guessing that for the police department, whatever success they may feel they've had with ceasefire approach in the past would make them more amenable to the approach you're trying to do with Hub. So that's my question.
I think broadly, I mean, specifically like within the Boston police, I mean, broadly speaking, I don't know necessarily if, you know, that's a direct correlation to be made that like if they do something in the past and they're willing to do it or be more willing to do it in the future, because like, you know, especially it's tough to tell that in Boston, because Boston Police Department, they've historically been known to collaborate, you know, for a number of different issues, be it gang violence, homelessness, substance use related, what have you. So they are very willing to participate in kind of these collaborative efforts. But again, the discussion shifts away from whether you're kind of like willing or unwilling to what are you doing when you are participating? Like, are you actually adding things to these discussions, or are you just there to show face? And I'm not trying to say that that's what they do indefinitely, but within the Boston police specifically, we're definitely past kind of the stage of like, oh, you're willing to do one thing, so you'll probably, no, we know you'll do it again because we know what you're trying to do here. We know that you'll participate in these collaborative efforts. But what we don't know is how much you're going to legitimately buy into the work of these collaborative efforts. Kayla, I don't know if you agree or disagree with that.
I agree. Watching the time.
Thank you.
So at this point, we have two, maybe three other folks in the queue. John, I'm sorry, Kevin, John, and then perhaps Rasan, if he's still in the queue. Kevin?
Hi, thank you for your presentation, Kayla and Isaac. I'm one of Isaac's professors at UMB, and I can say that we are all very, very proud of him in the social department at UMB. So thank you for this presentation. My question is actually somewhat similar to Robert's previous question. I'm kind of interested in kind of your big picture theoretical thinking right now. And I'm curious how you're thinking about your relationship with the Boston Police Department in this moment of this political debate about defunding or dismantling the police. So I'm wondering if this kind of like new movement and new debate has altered your thinking or your perspective about the hub's work in any way.
It's definitely thanks to you too, also Dr. Wozniak. So the hub and this current moment definitely has completely shifted, and I don't want to seem too negative of the Boston Police Department, but like to me, in my mind, it's like this is going to become like the biggest scapegoat for the police department to say like, no, don't defund us. We're actually doing this kind of more social service oriented work. Look at the hub here. Look, what we have the hub here in East Boston and Jamaica Plain, right? So I think that it's definitely going to shift towards more of like, whereas they were on the offensive before with give me this rah, 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 they're definitely on the defensive now, but they're going to use the hub as a scapegoat. That's what I predict happening. Just because, yeah, that's just my thought.
No additional thoughts, Kayla?
I don't.
Okay. Okay, I see. Thank you very much, Kevin. John, and then Rasan. John Bowman.
I think he's asking about restorative justice, but we don't do any restorative justice work. The hub is just to connect folks to resources and reduce risk and allow that individual or family to go on working with whatever the agency that's deemed the right agency for them to work with. So.
Thank you.
So Rasan and then Jasmine.
Thank you. Thank you. Good evening, all. My name is Rasan Peters. I work at Brigham and Women's Hospital as a violence recovery coordinator. I've worked closely with Kayla and Isaac and have been a part of the hub and have sat back and watched them work. I just wanted to thank them for the work that they do. And just FYI, when it comes to the hub table, that is an organic, genuine space. Everybody there wants to be there. Everybody holds themselves accountable, and everybody's there to just do the work. So once again, very hard, tough work that you all do. And thank you for allowing me to be a part of it and assisting the patients and families that I work with.
Thank you, Rasan. Thank you.
You're my guy, Rasan.
And now Jasmine.
Hi, Kayla. Hi, Isaac. So great to see y'all. So I guess just as a context, they have been so helpful in my own research and my own thinking about my dissertation work on a housing development in JP. And I've learned about the hub and the amazing work that y'all have done. And so my question is, I guess, somewhat related to Boston public housing. And so, just in being part of the hub to some extent, it seems the case that sometimes, right, housing insecurity can take many forms, and sometimes it can be the case that some homeless persons are like sleeping in hallways in public housing and things like that. So my question is in relation to how the hub deals with situations like that, and is there any sort of communication with like, I would say like public housing management or social resources or service resources at those locations to try to help individuals who are, I guess, in need in public housing?
Isaac, you want to start? And then
Yeah, I would say that there's definitely an adequate amount of coordination. I think that I don't know, I don't want to, be too broad, but with the development that we're referencing here in Jamaica Plain, there's a number of different entities that are involved in efforts to address quality of life issues within the neighborhood. So there's a lot of information flowing across social service entities. I think that I don't want to speak for both of us, Kayla, but I think that we can agree that what's lacking is the people that are actually going to go out and meet this person that's literally sleeping in the hallway, right? So we always know that the police are going to be willing to do it because it's their job, but it can be intimidating for some of these individuals that work for social service entities to walk into these environments that they would otherwise completely avoid, right? So there's definitely challenges because it's a very real situation, and it's kind of like it's rare that you go from the stairway to an apartment or the stairway to a single room occupancy unit, right? But what I would say is every step of the way, someone is involved that is connected to the hub, in every step of the way, whether it's a family member or a social service provider.
Right. And for those, Jasmine, who are chronically homeless, more than likely when we find them in some of those housing sites, they're already on Pine Street's list as being chronically homeless. And we then involve BPD and the street outreach team who will go to that site to meet that individual, address the issue, and try to see if they can get someone out there to get them to the shelter. If not there, we look at some of the scattered sites that we might be able to get them housed around in that area.
Thank you very much for that, Jasmine. So we will get Kayla and Isaac's contact information in the chat as soon as possible. I have, since there's no one else in the queue, I have 4 questions. And so I'm glad that I have a little space to ask you. I'll try to get in as much as I can, unless my partner, Chris, would like to get in as well. So the first, I'm really intrigued by the process by which cases come to you. And in some ways, this might piggyback off of one of the earlier questions, but I think I immediately felt a concern about the extent to which biases might enter the process such that you are probably more inclined towards getting some types of people versus others, some who are dealing with some issues versus other, that kind of thing. It's hard to imagine how biases wouldn't come into play. I mean, they're in all of our systems. Is there any way to track that? Do you have some sense about that? I know that since you're probably not capturing all the broad pool of folks that police come into contact with or your partners come into contact with so as to compare, but has that come up as an issue?
I'll take this one. Definitely. Yeah, I would say that there are. I think, yes. Going back to what I was saying before about the kind of the tracking the crime across neighborhood and those trends, it's only based on, it's inherently based on the officer not having those biases, right? So bringing legitimate present issues that are existent within the community to the table, rather than focusing specifically on, a certain issue that is, serious, but not as in real time, if you will. So like another trend that we found is that depending on who's introducing the situation, going back to our statistics, most of our situations surround individuals that are experiencing homelessness or some sort of substance use related or mental health related crises, right? And, through the work that we've been doing, we've figured out that those 3 issues are, one, the catalyst for a bunch of other issues that we deal with, but 2, like some of the most intense and hard to deal with issues that do not have, immediate answers. So not to get too sidetracked, but we definitely see those biases in the forms of who's being introduced. I would like to say that it's not to just make us do the dirty work of the police department, but it's hard not to say that after dealing with the same kind of issue over and over and over and over again, where you would think that because we've dealt with it so many times, the process has become clear to everyone that, you know, just do this before you even come to the hub. Execute the process. But so yeah,
Right.
to answer your question, yes.
Right. Sometimes we wonder sometimes we may hear a hub case and you wonder, are we pulling stuff out of the drawer? And it's those individuals that are in Jamaica Plain who are hanging out at the liquor store, who are homeless, who have some addiction issues, who have some mental health issues. That those are the only ones that we're hearing, versus some of the other cases that may involve youth. We've seen an uptick in youth violence, ages about 10 to 15-year-olds committing robberies. There might be some truancy. You have a mom who may be working overnight, and you have a youth who is out. And we would like to see more of those cases, and we would hope that you would not utilize all of the hub time. And if that is the issue with the individual, where they're homeless, there's some mental health and there's some addiction issue, there's a best clinician in each of those police stations who you can then refer that case to, versus making it a hub case. And you know, it opens the space for us to address some other issues.
That makes perfect sense to me. It actually, in some ways, maybe allows me to ask you my next question. It's hard not to imagine that, you know, resources, you don't have endless amounts of resources. And so you have to choose. And I think in learning that a significant percentage of the folks that you help are what sounds like single males who are between 40 and 59 or something like that. I think you said, 75% of the folks you help are like that. And then I think about the woman with the 3 kids that you helped. And I know it doesn't have to be either or, but I suspect sometimes it does. And if I had to choose who to help for like long-term bang for one's buck or whatever however you want to describe it, I have to admit, I go with the woman and the children because that would seem to have much longer and maybe wider benefits. And so do you find yourself in a situation where you're making those kinds of decisions? I mean, it sounds like people are being prioritized and it's the older males. But is there ever a situation where you sit down and say, well, let's think about what this means long-term. If we help this woman and her 3 children, this might actually produce better effects for the children over the long term, as opposed to helping that one man. I know it's hard, but I have to, it's what's on my mind.
I don't think we ever have to choose. I think once the partners are at the table and we can refer that family to whatever that resource is, we will refer them. I think sometimes we take a real special interest in some of our cases, specifically mom with the 3 boys. And that's why we've stayed in touch with her for as long, because we want to see her successful. We want to see she and those 3 boys flourish and, you know, move out of that space that she's in. It's hard. And I mean, even as a mom of teenagers myself, so I can only imagine. So we don't have to choose. In those cases, when we're seeing that 40 to 59-year-old male, sometimes we have to say, I don't think this has to be a hub situation this week. I think we just need to have the best team deal with this, or we need to refer them to Arbor or whoever that neighborhood partner is, or whoever that partner is at the table, versus making it a hub situation. Because some of those cases are just better dealt with that way, because every partner at the table don't necessarily need to hear that same kind of situation again.
Okay. I know we're at time. I'm hoping that I can ask you one more question.
Okay.
So Kevin brought up the context, the kind of Black Lives Matter, police brutality, defunding police context. But the other major context now is COVID-19. Mm-hmm. And so I'm wondering to what extent the pandemic has affected the work that you all are doing. Has there been a major uptick in cases? Like what's your experience been over the last 10 months?
So what we have seen is an increase in domestic violence cases over the past 10 months. We have seen a sharp rise in the number. Thankfully, we have a DV partner at our table. We don't meet weekly, we meet via Zoom weekly. And sometimes if we need to get out, we do get out. Also, there's a street outreach team who's still out working and still addressing those issues. So there's constant communication with them about whatever that hub situation may be. Most oftentimes, if I have a hub situation and I need to meet with him, I may get out and leave home and go meet with him, but we continue to do the work. But DV, we're seeing quite a bit of DV. I think our last 3 cases were DV cases.
Well, thank you very much for that. I really appreciate it. And thank you both for coming here and sharing about the amazing work that you want to do. And I'm hoping that you all have the greatest success in expanding to these other sites. This is really incredible. I don't know if you've noticed, but in the chat, everyone wants to get your contact information. So be ready for a whole bunch of messages in your inbox. And it sounds like a lot of people want to talk, collaborate, etc. I think that speaks to the value, the importance of the work that you're doing. Thank you so much for coming and sharing with us. And we hope that we could stay in touch and find out more about what you're doing.
Thank you so much for having us. Thank you everyone for joining.